Can you please introduce yourself?
Sure. My name is Megan. I'm one of the infusion nurses here at the Developmental Therapeutics clinic at Northwestern.
How do you typically start your mornings?
How do I start my mornings? I get up pretty early, a lot earlier than I think I need to. I get up at around 5-ish and I make my coffee, I take a shower. I kind of like to walk around my apartment, listen to a podcast. I don't like to rush in the morning, so I like to start my day kind of slowly. I like to drink coffee before I get here, like sit at my desk for a while, and just kind of ease into my day. I definitely like to be up early in the morning.
Who was your role model growing up?
My role model growing up was definitely my mom. I think still to this day, it's my mom. She's a very hard worker. She also works in healthcare. She's in healthcare administration, and she's just really inspiring. She's always worked very, very hard for her kids, for her family. She's a very, very smart woman, and everything she does I think is just really cool. And to this day, yeah, she's still my role model.
What specialty or subspecialty are you in and why?
I work in oncology. I've always worked in oncology. I've known I wanted to work in oncology since I started volunteering in a radiation oncology clinic in high school, and I just really fell in love with the patient population. They're just a great group. They're very appreciative. They're very thankful. They're just a good group of people to work with, and I've always just felt really passionate about it, and that's what drove me to become a nurse.
What is something that motivates you?
Something that motivates me, I guess, in my work, it's just doing right by my patients, learning and trying to give them a good experience. In life, I guess, just kind of keep going and getting through the winter every day is just, every day is an accomplishment, I think. And that's how I kind of feel with these patients as well. They're definitely kind of a good motivating factor, and they give you a lot of gratitude, keep you very grounded.
Can you share a memorable experience with a patient?
Yeah. One of my favorite experiences with one of our patients was we do the certificates here in clinic. I'm sure you guys have heard about them. And we did one for a particular patient that I was very close with called the Sunshine Award. And she was truly a ray of sunshine. She was so kind and she was so sweet and she was just so wonderful to be around. And she just appreciated so much. We gave her the award, and it's a certificate. You never know how the patients are going to react, but she was crying. She was so thankful. I mean, it really meant the world to her, and that was a really memorable experience. I felt like I was really close with that patient, and that was really special for all of us, I think, here.
How do you build trust with patients in your care?
I think I build trust by kind of getting to know them on a personal level. Kind of, sharing a little bit about me and them sharing a little bit about them. I think it's not always the easiest route, but it's a really good way to get to know them, understanding a little bit about them as a person, and I think getting them knowing a little bit more about me as a person, kind of outside of like, oh, I'm your nurse and you're my patient. Like knowing them as who they are as a human, their hobbies, their interests, where they grew up, and their kids, their family, things like that.
Have you had any memorable experiences with the patient's family or friend?
Yeah, I definitely like getting to know the patient's family members, especially when they bring their friends in. I think it's really fun to get to know their friends. I think it says a lot about them when you kind of get to know who the patient's friends are, because you choose your friends. So it kind of really says a lot about who they are as a person. So getting to know like patients like girlfriends and like telling stories about like when they were like in high school or when they were in college, those are always really memorable experiences for me.
What aspects of practicing medicine do you find the most challenging?
Working with, this population, it's a lot of these treatments are palliative in nature, so we do lose patients a lot, which is very, very challenging. It's something that you never really get used to. I think what is rewarding about it is that you did kind of make their time here more valuable. You did what you could to give them, the time that they want and the time that they, needed, and made it how they wanted. They all kind of have a lot of autonomy over their treatment decisions. Dr. Che is really good about, kind of talking with the patient and developing a plan that's good for them. So I feel that their time, that they spend with us is valuable time. So while you do kind of, lose patients, you kind of do see them, at low points. You see them at high points as well. You see them get cured. You see them go home with their families. I think that's really meaningful.
In your opinion, what are some traits that make a good healthcare professional?
I think empathy is like huge. You have to, be empathetic. Understanding patients is a really big one. because, a patient could be having a really bad day, and I think you have to kind of understand that it's probably nothing personal, and, there's so many things going on with these people, and they might be having a bad day for a variety of reasons, and it's not necessarily something that you did, and kind of taking a step back and saying, what could possibly be causing this, being really patient with people. They aren't medical, most of our patients aren't medical, so knowing how to explain things in a way that makes sense, because we do it every day, it's second nature to us, but most people don't have like the knowledge base or the patience, and just kind of understanding, trying to put yourself in somebody else's shoes is really important for this job.
How do you collaborate with other healthcare professionals, such as physicians and nurses?
Just transparency, I think, is important, and just, coming at them in a way that everybody works differently. Our communication styles are all very different. We actually did a retreat on it here in this clinic on communication styles and how people talk to each other best, and I think that was really helpful because, you got to see everybody's color. Everyone had a color, and your color was like how you like to be spoken to and how you like to be communicated with, and knowing, and this is a small clinic, so I think that was really helpful. So just like kind of knowing, how to approach people. Some people like a more direct approach, some people don't. I personally don't like a super direct approach. I like to kind of just talk things through like slowly.
Can you share a memorable experience with a fellow healthcare provider?
Nurses that I work with here are amazing. Just yesterday we had to call an emergency. We had to call in the emergency team on a patient. We called a MERT here, and I was the charge nurse. So I came back to the nurse station. I said, "Hey, I'm calling a MERT and this patient in this room," and immediately like all 5 of the nurses at the station, what do I need to do? And they just like followed the steps. And within 2 minutes, like everything was taken care of. This patient got transported to the emergency room right away. Someone's communicating with providers. Somebody is communicating with, our operations team. Someone is like at the doors. Someone is printing out the labs. It was just really supportive. I feel like I have a lot of support from the nurses here, and it's really nice.
What is a challenge you feel healthcare professionals face today?
I think the obvious answer is COVID. It's really changed the face of healthcare. It's changed a lot of things about the way we do things here, and there's so many more unknowns than there used to be. We can't just do things like we used to. We can't just bring in a patient and do something that we necessarily used to be able to do. There's like testing involved. There's just more time involved. You have to be really careful with a lot of things. It's just a bigger precaution. It's a challenge, and it's definitely made differences in staffing and the level of care that we can provide, and it's been a challenge for sure.
What is the greatest lesson you learned from your overall medical experience?
Just be appreciative of like what you have. Take a step back. Patience, gratitude, empathy. Those are all just things you learn along the way. You learn so much from your patients about what's important and what's not important, and how to just be a better person. Overall. Patience is a big one. I think I definitely learned a lot of patience from this job. I've learned a lot from the people I've taken care of, because it's just, especially at Northwestern, I'm lucky to be able to take care of people from, all over the city. It's a great place to be.
And lastly, what is one piece of advice you have for aspiring healthcare professionals?
You can do it. It's really hard in the beginning. The first year is like the hardest thing I've ever done, my first year of being a nurse. I worked on stem cell transplant inpatient, and it was so challenging, and I didn't think I could do it. But you can do it. You just have to kind of keep trying, keep your head up, don't beat yourself up too bad. It's so worth it. It's a great career. I would never want to do anything else. That's, I guess, my best advice.
All right, thank you so much.